Hello everyone, and welcome back to the antibiotics, clinical pharmacology of antibiotic. I'm Dr. Hassan, Associate Professor of Clinical Pharmacology, Drug Therapy and Clinical Research. In this session, brief session, we are going to speak about beta-lactam and beta-lactamase inhibitors. Okay. So this is the list of beta-lactamase. So the session about beta-lactamase inhibitor. Okay, as you can see from this list here, we are familiar with the first three name of beta-lactamase, clavulanic acid. You are familiar with the clavulanic acid. We are familiar with the sulbactam, tazobactam. We have another three group of medications like introduced to the pharmaceutical company, to the hospital recently. We have avibactam, we have fabrobactam, we have rilibactam. So we are going to speak about the six beta-lactamase inhibitor: clavulanic acid, sulbactam, tazobactam, avibactam, fabrobactam, rilibactam, and cover in this session, in this brief session, about the beta-lactamase inhibitor. Okay, as you can see here, the purpose of this group of medication. What is the purpose? They found some bacteria produce enzyme. This enzyme cleavages the beta-lactam ring. Okay, will make the bacteria inactive. Make the antibiotic inactive. Make the bacteria reduce resistance towards the antibiotic. So the main reason here, producing enzyme called beta-lactamase, and this bacteria start resist the antibiotic. For this reason, they developed something called beta-lactamase inhibitors. The beta-lactamase inhibitors bind and protect beta-lactamase, protect deactivation of beta-lactamase. I have it in the slide here. I will share you the. So this is what we have in bacteria produce the enzyme called beta-lactamase. As you can see it here, the bacteria produce enzyme called beta-lactamase. And this beta-lactamase is responsible for cleavage and destroy the beta-lactam ring in the antibiotic. For this reason here, they developed beta-lactamase inhibitor compound. We have 6 of them, but what we have here, we have 3 of them. For example, clavulanic acid, sulbactam, tazobactam, fabrobactam, and other. And this group of inhibitors produce protection to the antibiotic, prevent maybe deactivate of antibiotic. Okay. Some examples here. As you can see, we have we talk about penicillin. We have amoxicillin and clavulanic acid, and the brand name Augmentin. Amoxicillin and clavulanic acid, brand name Augmentin. We have ampicillin with sulbactam, unicin. Okay, injection. We have piperacillin with tazobactam, zocin. So we have 3 medication belong to the penicillin: amoxicillin, clavulanic acid, ampicillin, sulbactam, piperacillin, tazobactam, with the brand name. We need you to be familiar with the Augmentin, unicin, and zocin for the maybe the practice, for your practice. Here we recommend you to use both generic and brand name for each medication. So we need generic in this stage. We need you to be familiar with the generic and brand name of each medication. Okay, this is a recording to the penicillin. What about cephalosporin? For cephalosporin, one slide only. You can see here cephalosporin and beta-lactamase inhibitor combination. We have Zyprexa, we have Avicaz. For the Zyprexa is like ceftazolin, and tazobactam, ceftazidime, and avibactam. So you can see here we have third generation cephalosporin, combined with a beta-lactamase inhibitor, effective against resistant Enterobacter and Pseudomonas aeruginosa that produce multi-resistance, Pseudomonas aeruginosa. And this medication prescribed to the patients from infection caused multiple resistance pathogens. For example, if the patient comes to the clinic from intra-abdominal infections, in this case, we prescribe Zyprexa or Avicaz with a combination with a metronidazole. This medication prescribed IV, and especially we keep this medication, reserve this medication for severe infections. So now we have the first group. If you remember, I will go back to the first slide. We have penicillin and beta-lactamase inhibitor. We have amoxicillin, clavulanic acid, ampicillin, sulbactam, piperacillin, tazobactam. What about cephalosporin with the beta-lactamase? We have Zyprexa, ceftolozane, tazobactam, and ceftazidime, avibactam. Okay, this for the intra-abdominal infection, and this recommended for the severe infection. Okay, the third one, carbabinem. We combined carbabinem with the beta-lactamase and meropenem with the beta-lactamase, and you can see here we combined for urinary tract infection, meropenem with the fabroctam, for the urinary tract infection. Okay, and patients are from, for example, pyelonephritis, we can combine imipenem, cilastatin, rilbactam for the treatment of pneumonia, especially hospital-acquired pneumonia. Okay, in this screen here from Google Image, I share with you Zyprexa here, and Zyprexa is like ceftolozane with the tazobactam, ceftazolane with the tazobactam, Zyprexa. And then we have Avicaz. You can see ceftazidime with the avibactam injection also. Moving to the meropenem. Then we have imipenem, cilastatin, and rilbactam. So all these medication available like combination of treatment. Okay. So the question here, we can go with it, that what is augmentin, what is unicin, what is leucine, what is Zyprexa, what is Avicaz, and which medication used for intra-abdominal infection with the combination with the metronidazole, which medication belong to the carbabinem combined with the beta-lactam used for complicated urinary tract infections, hospital-acquired pneumonia with the imipenem, cilastatin, rilbactam.